Welcome back to AllAboutRx. Today, we are breaking down the absolute engine of the human body, the cardiovascular system. We're covering the anatomy of the heart and the structural hierarchy of our blood vessels. By the end of this, you'll have the exact clinical knowledge you need to master your pharmacy exams. Let's get right into it.
To make this super efficient, we're going macro to micro today. We'll start with the cardiovascular engine itself, map out the heart chambers and flow, check out the 4 heart valves, and then trace the vascular vessel hierarchy. Finally, we'll lock it all in with a quick recall summary.
The cardiovascular engine.
Let's look at this incredible central pump. Your heart is a muscular organ resting slightly left of center in the mediastinum, sitting right there on your diaphragm. And it is an absolute powerhouse. It pumps roughly 7,200 liters of blood and beats about 100,000 times every single day. Its one and only job? Collect deoxygenated blood, send it to the lungs for a refill, and pump that fresh, oxygenated blood to every single tissue in your body.
Section 2, Heart Chambers and Flow.
Okay, so how does it actually do this? Well, the heart is divided into right and left halves with 4 chambers total, upper atria, lower ventricles. To keep this straight, just remember this golden rule. Right receives, left launches. The right side receives deoxygenated blood from the body and sends it to the lungs. The left side receives that freshly oxygenated blood from the lungs and literally launches it out to the rest of the body.
Now here's a massive exam tip you'll definitely see. The left ventricle has the thickest myocardium, the thickest muscle wall of all 4 chambers. Why? Because it has to generate the absolute highest pressure to push blood through your entire systemic circulation, from your head all the way to your toes.
To easily remember the exact path of that blood flow, use this mnemonic. TV Shows People Mitral Aorta. It's a total lifesaver for test day. Let's break it down.
We'll map the first half. Deoxygenated blood returns from the body, enters the right atrium, and goes through the tricuspid valve, that's the T in our mnemonic. It drops into the right ventricle, which is the V. From there, it's pushed through the pulmonary semilunar valve, the S, and out into the pulmonary trunk, the P, heading straight to the lungs. For the second half, the clean blood returns from the lungs to the left atrium. It drops through the mitral valve, our M, into the mighty left ventricle. Finally, it gets launched through the aortic valve, into the aorta, that final A, out to the whole body. TV Shows People Mitral Aorta. Simple, and it works every time.
Section 3, the 4 heart valves.
So, valves are our unidirectional gatekeepers. We've got 2 atrioventricular, or AV valves, and 2 semilunar valves. The tricuspid on the right has 3 cusps, and the mitral, or bicuspid on the left, has 2. Basically, AV valves prevent backflow during systole, when the ventricles squeeze. The semilunar valves do the exact same thing, but during diastole, when the heart relaxes.
Clinically speaking, there are 2 huge things to know here. First, rheumatic fever notoriously targets and damages the mitral valve. Second, out of all 4, the aortic valve is the most frequently diseased and replaced valve in surgical practice. Definitely commit those pearls to memory.
Section 4, the vascular vessel hierarchy.
All right, leaving the heart, let's follow the plumbing outwards. Blood enters this vast, progressively narrowing peripheral vascular tree, starting from the mighty aorta. Here is the cascade. Blood flows from the aorta to arteries, down to smaller arterioles, into microscopic capillaries, and then back up through venules, into veins, and finally, the vena cava. The big takeaway is how the vessel's function completely changes as blood travels from the high-pressure environment of the arteries down to the low-pressure capacitance system of the veins.
Now, structurally, all these blood vessels share a 3-layered blueprint. We've got the tunica intima on the inside, the tunica media in the middle, and the tunica adventitia on the outside. And it's actually the variations in that middle muscle layer, the tunica media, that completely determine how each specific vessel functions.
Let's break those down, starting with arteries. These are high-pressure conduits carrying blood away from the heart. They are incredibly rich in elastin to handle the sheer force of every heartbeat. And here's an exam tip. Because of this massive pressure and high elasticity, large arteries are the prime sites for aneurysms, where the wall dangerously balloons out.
Moving downstream, we hit the arterioles. Think of these as your resistance vessels. They're packed with smooth muscle and are the main regulators of your local blood pressure. Because they control systemic vascular resistance, they are the exact target for blood pressure medications like ACE inhibitors and calcium channel blockers.
Next up, capillaries. Honestly, the most important site in the entire body. They're just a single cell thick, literally just one microscopic layer of endothelium. This is the absolute only site where true gas, nutrient, and waste exchange happens. They're so vast that no cell is further than about 100 micrometers away from one.
After exchange, blood heads back via the veins. These are your capacitance vessels. They act as a massive low-pressure reservoir, holding roughly 60 to 70% of your total blood volume at any given time. Since their walls are thin and pressure is low, they rely on one-way valves to prevent blood from pooling in your limbs. If that system fails, it can lead to dangerous clots, like a deep vein thrombosis, or DVT.
Bringing that all together, just look at the massive differences here. Arteries carry blood away, they're high pressure, thick, and elastic. Veins carry blood toward the heart, they're low pressure, thin, rely on valves, and act as a huge reservoir.
Section 5. Quick recall summary.
Let's wrap up and lock this in with a quick recall for your exams. The heart has 4 chambers and 4 valves. The left ventricle has the thickest wall. Arteries carry blood away, while veins carry it toward. Every vessel has 3 layers, the tunica intima, media, and adventitia. Capillaries are your sole exchange site, and veins act as the capacitance reservoir, holding 60 to 70% of your volume.
I want to leave you with this provocative thought. If a single microscopic capillary is only 1 cell thick, how does this vast cardiovascular network adapt when thousands of them are damaged by chronic high blood pressure? Think about what that does to systemic vascular resistance. We'll explore exactly what happens structurally in those disease states in our next explainer. That's it for today's anatomy breakdown. If this helped your studies, don't forget to like and subscribe to AllAboutRx for more pharmacy content. See you in the next one.